Dr. Esmail, the board certified facial plastic surgeon, hair transplant surgeon, answering your tweets and questions about hair transplant. At Big Damage, all the hair transplants actually come from one guy who is super hairy. I mean, in all seriousness, you can actually take hair from the body and transplant it to the head. It is a thing. But also on this note, very interestingly, I think in the next 5 years, hair transplant is gonna like have a huge shift with basically stem cells. So essentially, taking one hair instead of multiple hairs and then cloning that hair so you can have infinite amounts of grafts basically in a hair. So interesting that you say that the comment is kind of funny, but also some truth to it. It's gonna happen eventually for sure. At this, that, other, two. I'm not speaking from personal experience, but hair transplants take far, far more than a few weeks and often end up looking worse than the original baldness. There are potential side effects as well. Let's break it up. First part, they take far, far more than a few weeks. Yes, they take months. So your end result is anywhere from like 12 to 2 years, 12 months to 2 years. So yeah, they take a long time. I had a transplant. Actually, I thought the first one didn't even work and then started growing in, and I had a second one. I think my hair looks pretty good now. And they look worse. So this is all about one, patient selection, and two, skill of the transplant surgeon or team. One, if you're not a good candidate and you get a hair transplant, it's gonna look like crap. If you're almost bald, like completely bald, you're unfortunately you're not a candidate for hair transplant. And if you get a hair transplant, you'll never be able to get enough hairs for it to make it look, or enough grafts for it to make it look good and natural. So, I mean, in that instance, yes, that would be true. And side effects, I mean, I don't know if there's really any side effects from hair transplant as it is. I haven't really seen that besides like not getting graft take or the hair transplant not being done well, which definitely does happen. I mean, I don't think there's any other side effects. So, I mean, go to someone who's experienced, who's done a lot of hair transplants, and if you're not a candidate, they'll tell you not a good candidate, and you'll get a good result. I mean, the success rate and the amount of people that get good results or are happy with their results is like well over 95% in the hands of experienced surgeons. At Argyle Boots, it takes a while to heal and for the hair to start growing after hair transplant surgery. Well, half of that's true, Lindy. The first part, not true. To heal, I mean, I I was at a Jets game 3 days after my hair transplant, so I don't think it takes that long to heal. You look pretty much like a normal bald guy after 5 days. So I'm not sure about the healing part. The growing part, yeah, it's true. It takes 6, 9 months. I mean, I think hairs grow with like non-traumatic techniques. Hair grows faster than it did 5 years ago, especially with stuff that we do with ATP and new technologies. But yeah, 12 months. You gotta wait for that hair to grow for sure. At Fermi Poo. Question for hair transplant guys. I guess that's me. I'm a hair transplant guy. I did it. Had one. Anyways, does the rest of the head keep balding? Yes. So it won't be full in the front and then keep balding in the back? Yeah, it's true. It's a very true thing. So that's why if you're gonna get a hair transplant, you need to commit to taking medication because exactly as this guy says or thinks, it's true. If you get a hair transplant, the majority of the grafts you're gonna get are gonna be in that first 2 inches of your forehead. And if you're not taking medication and you continue to have male pattern baldness, you'll continue to bald past where you got your hair transplant. And yeah, it'll look stupid. So if you're getting a hair transplant, you're gonna spend the money to get a hair transplant, commit to taking medication as well. All right, at suicidal. Question. If a man has curly hair and gets hair transplant, is there a chance that the hair could grow back straight? That's actually a good question. No, because the hair is genetically programmed to grow curly. But the one thing with hair transplant, people with curly hair, it's interesting actually. It actually does make hair transplant more difficult because when you're taking the grafts, inside the head, the hair actually curls. So if you have a straight hair and you're taking a graft, you go straight down and you take the follicle straight. If you have curly hair, especially in like Africans, African Americans, um, the hair actually, well, beyond the skin curls. So you have to, when you take the graft, you have to do this motion for a curling graft. But anyways, that's a side note. No, curly hair will continue to grow curly. At Mao Tenshi Akuma, I have a serious question. You got a hair transplant, right? Then why the F is your eye so swollen? That's because swelling comes down with gravity. So if you have swelling up here, there's nothing really to keep it up there because actually, if you go into the plane of the forehead, it's a gliding plane, meaning that, like, if you have swelling and it's right on your skull, it's going to come down up here and then it's going to go around your eyes. So, see, that's why. At Rejuvenate HT, when do hair transplant results start showing? If you had a hair transplant or are planning one, the big question is how long does it take to see results? Hair can start growing in 3 months, but really to see results, I tell people you'll start to see it around 9 months, 6 to 9 months. You'll start, and then final results, 18 months probably. At Winter Frey, this may be a dumb question, good start, but what actually is a hair transplant? Like, I understand it makes your grow back better, but what actually is it? A hair transplant is essentially you're taking hairs from the back of your head, where it's genetically programmed to continue growing, to the front of your head, where it's genetically programmed to fall out, where it's sensitive to testosterone or DHT. And so over time, with male pattern baldness, hair in the front will typically fall out in some people. Whereas even in those people, the hair in the back is programmed not to fall out. So you take that hair and you move it to the front and it continues to grow forever. That's what a hair transplant is. At Pretty or Petty X. Pretty or Petty X. Serious question. If a person is balding and they do a hair transplant, does that actually solve the alopecia? Like, wouldn't the hair still continue to recede from where it stopped? So alopecia, and typically when people are balding, it's like a male pattern balding. Not always, but there is alopecia, like traction alopecia, and by their picture, it looks like they are African American, and traction alopecia is very common in that population. So does it solve the alopecia? No. Like, if you're continuing to do the same things that you're doing in a case of like traction alopecia, where you're pulling the hair tight and you're losing hair in the front hairline, yeah, that'll continue to happen because what you're doing to cause the alopecia is still there. So it won't solve that. But in a case of male pattern baldness, it does solve the problem because it takes hair that's genetically programmed to fall out with hair that's genetically programmed to continue growing. So it just depends. At Twunkified. Okay, this may be a dumb question. So all the questions are dumb or serious. Anyways, okay, this might be a dumb question, but why don't more men get hair transplant? I agree. It dramatically improves your look. I agree. More than weight loss, Botox, dental surgery. I agree. And is much easier, cheaper, and much easier and cheaper. Are they scared? Is there something I don't know? I mean, I agree with basically this whole post. Why don't more men get? And I actually think that the amount of men that get hair transplants is like going up exponentially, because it used to have one. The techniques used to not be as good. The results used to be not as good, and so there was more from that aspect. And also there was some stigma around it. Hair transplants were more detectable in the past. Now I think that when you take those three things, and all of those three things have significantly improved over the past like 5 to 10 years. They also, the amount of people, guys that are getting hair transplants is way up, exponentially, I would say. So I think what he's saying is used to be true, but it's not as true anymore. And personally, as someone who's had a hair transplant, obviously I agree with this, and that like, why wouldn't you get one if you needed one? I mean, some people are not a candidate for hair transplant. So if you're like basically like completely bald, and you have like this little ring of hair, may not be a candidate for a transplant. But for most people, it's pretty good. Or if you look good bald, I mean, that's a you got a good shaped bald head, then that's a viable option as well too. I mean, some people look better bald, I would say. Actually, I just did my brother's hair transplant actually, and when he shaved his head, I was like, damn, he actually looked good bald. So, and his wife said the same thing too, and I was like, fuck, well, we already did the hair transplant. But anyways, all right, at Kyrus Sideburns. Serious question. See, every question is serious or dumb. Serious question. Can a person born female get a beard transplant, or would the hair fall out? No, absolutely. You can get a beard transplant. There's like many trans patients to get beard transplants. It'll continue to grow. All right, at DP 331. Even after hair transplant, you have to take finasteride and minoxidil. People have misconception that hair transplant gives you permanent hair. I mean, that guy is half smart. So it's like what he says is true, in that you have to take finasteride and minoxidil, but that's not for the hair that's been transplanted. The hair that's been transplanted actually is good. It'll continue to grow no matter what. You don't actually have to take medication, or you don't have to apply medication to that area. The medication that you're taking, or where you're applying it, is for the hair that was not transplanted in the areas that were not transplanted. So basically, most of this far part of the head, because you don't want to lose that hair and only have the hair that was transplanted left, because it'll look terrible. So you're it's like one of those things where it's like you're right, but you're not completely right, or you don't know why you're right, because the last part of it didn't make sense. But anyways, yes, you have to keep on taking medication. At Winnie Jalad, hair transplant is generally a one-time procedure, is it? However, if it's done at a very early age and your natural hair loss continues to progress, we generally recommend considering a transplant from, oh, that's a statement. If it's done at a very early age and your hair continues to progress, we generally recommend considering transplant from the mid-20s onwards, once the pattern of hair loss is more stable. If I think what they're trying to say is that it's generally a one-time procedure, which I don't know how true that is. I think that if you look at like people who've had really good hair transplants, they've probably had 2 or 3. Like if you look at like celebrities who've had really good hair transplants, like Elon Musk, I think he had 4. Yeah, I think Elon's had 4 hair transplants. So, and one of those was a FUT, which is like a strip. I mean, the chance that you're having a hair transplant if you're 50 and you're having a hair transplant, yeah, it's probably like the only hair transplant that you're gonna have. But if you have one, if you're having one and you're like 35, you're gonna have another hair transplant. I can almost guarantee you that. What she's saying about like having it later, like in your mid 20s, like I mean, how much fucking later? How much earlier are you gonna have it? Like in your mid 20s? I mean, yeah, I would say like 30s. Wait till you're in your 30s. Then you're gonna see the type or pattern of balding. Like, are you totally going bald here? Are you having baldness, like just recession in the hairline? Like, do you have a good graft site? Are you losing hair in your donor site here? I mean, a lot of those things need to declare themselves before you're gonna have a hair transplant. That might be in your mid 20s. Like there are some people where they come in their mid 20s and they're ready to go. I would say that's not the majority. The majority, mid 30s, 40s, that's kind of like where you're gonna kind of declare it. But some people earlier. Like for me, it was like early mid 30s. So my name is Dr. Ali, double board certified facial plastic surgeon. Thank you very much. If you have any questions, let us know. Answering your tweets and questions about hair transplant surgery.